So I've been asked to share a little bit about the Women's Health Plan and the focus that we have on developing research and to ensure that we close that gender health gap through evidence-based medicine. So the first Women's Health Plan for Wales was published on the 10th of December. It was launched in the Senedd, and we were able to, Sarah Murphy, who's the Minister for Mental Health and Wellbeing, is the Minister who will be overseeing the Women's Health Plan and the delivery of those key actions. And she also is a passionate advocate for women's health. And I think that prioritisation that we have of women's health in Wales right now, we need to take to our advantage. There are so many opportunities, and I hear of so many amazing projects and research that's going on at the moment around Wales that is to do with women's health. I think this is an incredibly exciting time. So what is the Women's Health Plan? If you have not looked at this document, I would encourage you to open it up. It's on the NHS executive site. It basically outlines that we have 8 priority areas around women's health. So we're going to be looking at menstrual health, endometriosis and adenomyosis, contraception, postnatal contraception and abortion care, preconception health, pelvic health and incontinence, menopause, violence against women and girls, and then those long-term conditions and ageing well. We have been criticised that perhaps we're having a slightly too gynecology-focused actions and outcomes from the Women's Health Plan. These were very much brought to the forefront, though, through the Discovery Report, which was a report published by Welsh Government in 2022 that took the voices of women and girls, around 4,000 women and girls, and it very much highlighted the need for focus around gynecology conditions initially. But I know, my hope is that as we focus on those conditions, we will focus on the holistic aspect of women's care, and that will broach onto other areas around cardiovascular disease, around end-of-life and palliative care. We were talking about that in our group earlier, around pain relief, that we know is such a difference in terms of how pain is managed in women compared to men. So I think this is a springboard. This is a stepping stone. And ultimately, this is a 10-year vision for women in Wales. And so we have opportunity to add and for it to change. So let's not be too focused on what it isn't doing, but what it is doing and how it can impact moving forward. So we have 4 key visions that I would ask you to sign up to. I would ask you to look at them and see where in your space and place of work you can perhaps get involved. So the first one is around access. We want to improve access for women in Wales to be able to have better health services. We want to make sure that, of course, we have a workforce that are skilled to deliver the health that women need. And that's at all aspects of health services, right from primary care, right to those interface spaces that we're calling women's health hubs, and then into our secondary care spaces. We want health boards to prioritise women's health. At the moment, we are under scrutiny and it is a minister's priority. What we don't want is for that to go off the agenda in 3 or 5 years' time. We need to keep it there, and we can do that collectively. And then finally, what we've talked about a lot today is around data. And of course, we often hear data is only as good as what you put in as what you get out. And it's about educating healthcare professionals to have accurate data that they upload. But what I've also been seeing and hearing is that often data is not disaggregated by sex or gender. So how do we know how health services are impacting or negatively impacting on women if we are not collecting the appropriate data? And of course, using that data to influence research and making sure that we have better outcomes for women. As I mentioned, it is a 10-year vision, but we do have expectations around short, medium and long-term actions. Short being up to 2 years. There's around 34 actions in the plan for the first 2 years, medium and then long-term actions. And we really wanted to embed the importance of research in this. As a healthcare professional who was studied and got my degree more than 20 years ago, it was forever drilled into me the importance of evidence-based medicine. And I think only in the latter years, over the last 2 or 3 years, have I been able to participate in what that looks like. And that's obviously through being able to apply and successfully apply for the Health and Care Research Wales Research Time Award, which has allowed me as a busy clinician a day a week to be able to pursue some of those interests that I have in women's health research. And what I would ask and plead is continue to involve your clinical colleagues. We're the ones who are seeing it on the cold, hard face often. We're the ones who are delivering medicine, that evidence medicine to our patients. And it's so important that you include us. We may say we're too busy, but I think if you continue to give the opportunity, that's so important. And yesterday we had the privilege of members in this room coming to join us in our first women's stakeholder group at the ICC, where we had around about 150 different stakeholders from healthcare, from academia and from charity and third sector coming to join us to start having those conversations around shaping women's health over the next few years. And the most important part that I wanted to get in there was around co-production. Because as a healthcare professional, I absolutely know that I have been in the past a part of that tick box. What do patients think? Tick, I've asked them, I've done a survey, I've done a monkey survey, tick box. But what does this mean as we're actually trying to co-produce services moving forward? It's about having those patients, those with lived and learnt experience at the forefront, at the heart of what we're doing. And I think we have an opportunity with women's health hubs to do that from scratch. We have a blank piece of paper. So a co-production framework is what we worked on yesterday, and we want to be able to make sure that's implemented in each health board. And I think it's in a particularly exciting time because there has been some financial resources that have been put into women's health research. The 3 million that's been put towards the first Women's Health Research Centre for Wales, which is being directed obviously by Jackie Boivin. And that's such an exciting opportunity that as a women's health network, we can collaborate on some of that prioritisation moving forward. And of course, the £750,000 that's being invested in that commission call around communication. This is what came out of the Discovery report. Women do not feel that they're being listened to when they go to see their healthcare professionals. And in regards to the communication that they're getting back, they think it falls far short of what actually should be expected. And so we're really excited about how those commissioned pieces of work can change how women's health is being delivered in the future. I wanted to pick up just on a few parts from the Women's Health Plan where we've been able to use research or where research could come out of some projects that are ongoing. And so, of course, the first one that has been mentioned already, I think, by Jeremy Miles this morning, was around the rapid review around interventions for preventing continence issues for birth trauma. And we've included this in our priority 5, which is around pelvic health and incontinence. And so highlighting the fact that we need greater research, more information, particularly around that qualitative element about what women are saying around pelvic floor exercises, about the impact of these on their birth traumas around incontinence and fecal incontinence. Such an important piece of work that we're hoping to be able to encourage moving forward. And then around priority 6, which is around menopause. So in Hywel Dda, those staff that were involved in the drugs and alcohol service were aware that they weren't able to meet the needs of their clients who were going through the menopause. And so started a training programme to be able to upskill themselves in knowledge of that transition period in the life course and how that impacts on those with addictions. And so Swansea University are involved in a piece of evaluation around that, which is something that could then impact training for all services in Wales. And as Natalie mentioned earlier, incredibly fortunate to be part of the Cardiff Trials Research Unit, who's looking at ESTEEM, which is an NIHR-funded trial for testosterone. A real hot topic is around menopause care and the use of testosterone. And we have evidence for its use in sexual libido, but we don't have any evidence around those other symptoms that we see in the menopause. And so we'll be looking at that over the next few years. Ageing well, because of course, women's health is not just around gynecological issues. We've had input from the Diabetes Network looking at closed-loop systems for management of diabetes care in women through the menopause and the perimenopause. And then also thinking around Ask and Act. So the implementation of that programme from Welsh Government and how actually it's being used in healthcare facilities to encourage women to disclose incidences of domestic abuse and sexual violence, and how that may then impact on training and education across the health systems. So next steps, as I said, we had a fantastic day yesterday. We have so many opportunities to collaborate around developing research projects here in Wales. And I think that's what I've been most encouraged about, is the linking in, the networking from across health, across third sector, charities, around patients and also around colleagues in academia. Because we have such an opportunity right now with the focus on women's health to make those changes. Thank you.